Hi, my name is Dr. Emmanuel MONNERON and I work as a psychiatrist in France, and this is another video for the series Psychiatry and the Trouble Teen Industry. If you don't know what the trouble teen industry is, you can follow the links in the description of this video to visit the Breaking Code Silence website and find important information about the trouble teen industry. This new video is going to be about making a diagnosis in psychiatry. If you think these videos are interesting, you can hit the like button and subscribe to the channel to see all the videos of this series. Classifying the mental disorders has always been a challenging task for the scientists and the psychiatrists. The first descriptions of these disorders were written centuries ago, and it's still difficult to classify them properly. In 2021, two classifications are commonly used by psychiatrists to make diagnoses. The International Classification of Diseases, or ICD, published by the World Health Organization, and the Diagnostic and Statistical Manual of Mental Disorders, or DSM, published by the American Psychiatric Association. For each diagnosis, you can check a list of clinical criteria that have to be met to make a diagnosis. But a lot of these criteria are symptoms that can appear in several mental diseases. They are not specific of a single disease, and it's the way they are combined and their evolution that allow a trained professional to diagnose a patient. Even if this is obvious, I want to remind you that you cannot measure anything when it comes to psychiatry. You cannot use a blood test, you cannot use an ultrasound or other exam to make sure that you diagnosed your patient properly. You can use some clinical scales, but even if they are reproducible, the results will depend on the way you use them and the way the patient wants to participate when you do the evaluation. What I'm trying to say is that making a diagnosis in psychiatry is a really complex task. To avoid making mistakes that are going to affect the therapeutic process, it's very important to take enough time to first create a good relationship with the patient, and second, be able to observe the patient for a long enough period to know their symptoms and the way they evolve as good as possible. Each patient is different, and creating a connection with a new person is an important part of a psychiatrist's job. Now let's talk about the differences between adults and children. Psychological processes are dynamic processes. That means that each person evolves constantly, and these evolutions are way faster during childhood and adolescence. That's the reason why psychiatric diagnoses are divided into adult diagnosis and children diagnosis. Being older than 18 years old is a criteria you can find in the ICD and the DSM when you look at the descriptions of adult mental diseases. And that's a nice transition to start talking about the trouble teen industry. According to the survivors' testimonies, a lot of inappropriate adult diagnoses, such as personality disorders, for example, are made in this private facility. Conversely, some residents of these programs are not diagnosed at all and are deprived of the proper care they need for months or sometimes for years until they are finally able to leave the facility. And that is not that surprising. A lot of these programs do not employ medical professionals, which really doesn't make sense, as they claim to be therapeutic boarding schools or residential treatment centers. They say they are able to help youth struggling with very different issues, when a lot of testimonies explain that medical appointments only happen every 3 months, with psychiatrists who only spend a few minutes with each resident. During my medical training, I have worked with children and teenagers, and I can assure you that it is pretty challenging. A lot of them don't want to see a doctor, and some only come to the appointments because their parents are forcing them. That means that it's pretty difficult to build a good therapeutic relationship with them, and also that they are not going to tell you what they're going through or how they feel during the first appointment, or during the second appointment, or during the third appointment. In this situation, it's pretty easy to understand why a medical professional is not going to be able to base their clinical evaluation and diagnosis on a short and single appointment. But that's how it happens in the trouble teen industry facilities, and that doesn't make sense. especially when you consider how much money the families or the state pay for a treatment that is supposed to be a high standards one. The last thing I want to say is that a diagnosis is not just a label you put on someone. It has a huge influence on the therapeutic process, on the treatment, on the way people see a person, and on the patient's life in general. A diagnosis should always come with a lot of information about the symptoms, about the treatments, the prognosis, and the comorbidities. Giving this information is an important part of the therapeutic process called therapeutic education, and it's another recommended and evidence-based treatment that is not provided in the troubled teen industry facilities. These programs have never been therapeutic. They've always been behavior modification programs, and the only thing that has changed over the years is the vocabulary they use to sell their services. But rebranding hasn't changed the way they treat their residents. They still do not employ enough properly trained professionals, and they do not provide evidence-based treatments, despite the fact that they charge the families and the state huge amounts of money. For all these reasons, it's still very important to talk about institutional child abuse and the troubled teen industry. It's important to read the survivors' testimonies and to follow Breaking Court Silence on social media. If you haven't done it yet, you can sign several petitions to ask the authorities to shut down some very abusive facilities. All the links are in the description of the video. I thank you for watching this new video, and there will be more content soon. Thank you very much.